Welcome back to Central Coast News. Time now, 18 minutes after the hour. We've got Dr. Joel Conn from Pismo Beach Veterinary Clinic with us here for another edition of Ask the Vet. Good morning, Dr. Conn. Good to see you.
Thanks for having me.
All right, so the topic today is something that, unfortunately, if you're a pet owner, you have to deal with time to time, ticks.
Yeah, and we're talking about it because it seems to be a really bad year for ticks.
Is that right? Yeah, it's no
I've been seeing a lot of animals come in that maybe we're even already on prevention, and we're still seeing some ticks and some problems with that. So one of the things that's really important to understand as a pet owner on the Central Coast with our beautiful weather is ticks are year-round. They're bad right now, and we're seeing them a lot right now because you're seeing the adults, and so they're much more visible, they're easier to find on your pet. But in fact, the tick population exists throughout the year. They're continuously breeding and cycling. And there's basically 3 distinct stages that range from nymph, which are the really, really tiny baby ticks, to the adults. And the nymphs can literally be the size of a pinhead. And they can still transmit disease. So
we've got some photos here. A couple of them kind of graphic, so just a word of warning here, but didn't want to interrupt.
Yeah, no, you can see how small that is.
Yeah.
And so if you're relying upon finding these on your pet, there's just no way. And so if your pet has exposure to ticks, you know, you go hiking, they're in tall grasses, weeds, things like that, even if you have them in your backyard, you want to make sure that they're on a year-round preventative every single month to try to prevent these guys. The good news is that there are lots of preventatives available. And for the most part, they work pretty well, and they're pretty safe. We've had products on the market effectively since about 1995. Frontline came out that year. We've been seeing some of these guys. So this is that same tick that you saw in the previous picture. This is after being on the pet for several days. So this is after a blood meal. These guys look like little corn kernels. So that at this point, of course, they're much more visible. Unfortunately, this is one that's been attached for a while. Now the good news is if those ticks do attach, as long as we get them off, usually within the first 24 hours, we're pretty safe as far as disease transmission. You can see here's a graphic of removing a tick from your pet. We think it takes about 24 hours in most cases to transmit disease. That's not 100% the case. Some diseases can transmit faster, but Lyme disease or Lichia, Anaplasma, some of the ones that you hear about, the tick actually has to be on there. And most preventatives are designed for even when that tick does attach, it's going to die and fall off within hopefully a few hours. One thing to be aware of is that, you know, ticks, of course, can transmit disease to your pets, but they can also transmit disease to a person. And so you want to be aware of that and check yourself after you go hiking. If you have pets, they can also be a source of bringing ticks into the house, so just kind of be aware of that. When you remove a tick, you have to be careful how you do it, because actually if you have any open sores or anything on your fingers and that tick ruptures as you're removing it, you can actually get transmission of the disease, assuming it's carrying a disease, to your body. So when you remove it, you don't want to ever use your kind of bare hands to pluck it off. You want to use pointy tweezers. We have a video here that kind of shows you. So this video shows these pointy tweezers grasping the tick by as close to the head as possible. That's really important. You want to try to get all those mouth parts out. This is a little bit graphic and gross, but it's an important thing to be aware of, unfortunately, where we live. So you grasp, kind of pull slowly, and hopefully that sucker will come out intact.
And how do you know that you've pulled it out successfully?
You can't always tell. I mean, usually you'll see like a little black speck left behind if there's mouth parts left behind. Unfortunately, in some cases, you just do the best you can, and those will usually come out like a splinter. As long as you get the majority of the body, the risk of disease transmission's pretty low.
And you talked about preventative measures. What can you do to try and best prevent?
Yeah, I mean, you want to use a monthly topical. So basically, the tick preventions that we have available either come in topical form or collar form. There's nothing oral at this time. That's in the pipeline. Frontline Advantix you can find over the counter. I don't think they work great for fleas anymore in our area, but I think they work just fine for ticks. There's some newer generation products like Vectra 3D, which you can get through your veterinarian. And there's a collar called the Prevent Tick Collar, just does ticks. Very, very, very effective tick control. And that's actually kind of an affordable one because it'll last for 3 months on your pet. So there's some great options out there. Talk to your veterinarian. They can help you out.
So not 100%, but like you said, I mean, can be very effective.
That's right,
Well, we appreciate it. Thanks for the insight on that. hopefully no
problem.
one has a tick problem, but certainly some good information to be aware of. Dr. Joel Conn, Pismo Beach Veterinary Clinic, joining us today with Ask the Vet. Appreciate it. We'll see you in a couple of weeks.
Okay, see you.
All right, we're going to be right back after the break. Stay with us.